Okay, what I'd like to do right now is talk about one of the primary causes of low back pain that we see clinically here at Modus RX Physical Therapy. And of course, we have to bring it back to food because that's constantly what's on our mind around here, it seems. But we're going to call this cause of low back pain the tightness sandwich. Okay? If we think about three of the important portions of our body that sit on, above, and below our center of mass, that's going to be the hips and the pelvis, the midsection, the lower back, the lumbar spine, and then the thoracic spine or the mid-spine and rib cage, okay? And if we look at those three segments, clinically what we see day to day and what we see kind of in a population pattern is that a lot of individuals tend to develop tightness up here and tightness down here. And those areas are actually designed to be mobile segments and mobile areas of the body. So because of different aspects of our culture, because of sitting, because of lack of movement for a lot of us in three-dimensional or three planes, we don't keep mobility in those areas like we potentially should be throughout our development and throughout our lifespan. And then what happens is we develop that tightness sandwich. So these areas here and these areas here that are meant to be mobile become stiff and restricted, and what sits directly in between those two areas, i.e. our lower back and our lumbar spine, I don't want to say it's forced to become unstable because I don't know if that's necessarily correct or exactly what happens, but I will say that the forces and the transfer of energy between the two segments above and below becomes far less efficient, and we place more demands on the structures and the tissues and the muscles around that area to probably pick up some of the slack. So, for example, if I need to rotate to do something in my daily activity or in an athletic performance-based activity, and I don't have movement up here, okay, I should be able to rotate and move pretty well through here. I should be able to extend through my mid-back. And what's going to happen is if I can't, but I still want to complete that task, I'm going to start to engage the midsection or the core a little bit more, or I'm going to ask it to move more to complete that task. Because my body doesn't care how that task gets carried out, it just cares that it gets carried out. Same thing through the hips, so the rotation through the upper component is very important, movement through the upper component, the mid-segment is very important. Movement through the pelvis and the hips is very important. So if I can't rotate through my hips very well, if I can't extend my hips as well as I could, a lot of things for squatting, if I can't flex the hips very well, then again, the lack of movement through the hips is going to place increased stress and lack of efficient energy transfer through my low back and through my spine. And so that's where that tightness sandwich really comes from, is a lot of us are tighter than we should be through here, we're tighter than we should be through here, championship belt, and then the midsection or the core is not getting as efficient energy transfer as it should be, and then our low back is seemingly what pays the price for that. So that's the aspect of a tightness sandwich that we see a lot clinically in a lot of individuals with low back pain, or basically in the population in general, even if they're not having pain. That seems to be a common trend. This is one of the primary causes for us for low back pain. If you have questions about how to address it or how to self-assess, certainly give us a contact. There are also resources on our webpage and on our YouTube page that you can go to work on mobility through here, to, in effect, keep a healthier low back. Hope you enjoyed the content today, and have a great day.